Well, hello everybody, this is Dr. Schroeder with this week's video introduction to week number 7 on our course in evidence-based practice. And we've come a long way as always. We've done pretty much all the heavy lifting for the course. This last week you completed your evidence-based practice projects. You've submitted those papers and I will be grading those through the week. I would anticipate that they should be graded probably all by the weekend. It takes me a little while to grade those, a little bit longer than the evidence-based practice part 1 papers, just because they're a little bit longer, and the feedback is usually a little bit more in these particular papers. But we've really pretty much wrapped up that project. And so in week number 7, you're looking at a discussion question with a few different parts. And the first part is to write a 250 to 500 word synopsis of your evidence-based practice project, and including your PICO question. And in other words, this is where you're going to essentially start with that PICO question and go through and take that entire project and just in between 250 words, summarize it. What does it mean? How is it important? This would be like the equivalent of like an executive summary statement. This is an important part of this evidence-based practice process. And then going along with that, you are going to discuss how you would disseminate the information from this project, or how you would disseminate your findings. We're going to kind of pretend that you would shoot ahead, 6 months or a year, or however long you said it was going to take you for some data tracking to see if this project was useful, and to see if it resulted in the outcomes that you were looking for. And then it's important. You got to get that information out there. And so how you would disseminate it. Think in terms of not just within your hospital. Of course, you want to disseminate information within the hospital. Think a wider area. You're going to want to communicate with other hospitals, with other organizations, nurses for other agencies, other disciplines. So how would you disseminate this? Think in terms of journals and research conferences. That's usually where this kind of information is shared. It's rather limited just sharing it within your particular facility or within your particular unit. That really isn't that useful. Usually the staff know if it works or not anyway. But getting it out there as part of the nursing research community is really what's important. And so you're going to discuss in those kind of terms how you would disseminate this information. And then you're also, in your discussion, is going to describe how you perceive your role as a graduate prepared nurse in relation to the AARHQ agenda. And actually, most of your reading this week and most of the focus of the materials this week is focusing on the Association for Healthcare Research Quality. It is rather a big organization, and it is one that is very important to us in research quality, because this is really one of the main clearinghouses for health research and healthcare research. A lot of the projects that you've been working on, if you are really serious about it, and if you think that you have a project that may be worthy of actually implementing in a facility, you may want to consider a grant through the association. There are grants available for most of this stuff out there. These projects they tend to be very costly, and one of the tasks that you had in your evidence-based practice part 2 was to go through and really figure out the cost if you did the assignment correctly. And that cost can be substantial. If you've got 50 or 100 nurses that you have to train, and it's going to take 4 hours to train them in a new process, you convert that into dollars lost. Just the dollars lost because you've taken a nurse off the floor that you have to pay 4 or 6 or 8 hours of training to, and then you have to replace them on the unit. It can get costly, not even looking at any new equipment or any new software or any new resources that you may need. That's all very, very expensive as well. But it's just a simple project. Coming up with a new form can easily cost an organization $50,000 or $100,000 easily. It's not cheap propositions here, and so there are grants available to facilities and to nurses that are looking for them. And so that's what we're going to be discussing this week. As always, I'll be participating in class with you. Fairly straightforward. Of course, I will mostly be giving feedback on your papers, and that will be most of my time spent in class. But giving some feedback on this is important. So I'll be giving some feedback, particularly probably Wednesday and Thursday, a little bit on Friday is when most of my feedback will be given in the class. The rest of the time primarily will be spent grading. So I look forward to participating. We're getting towards the end of class, one more week after this one. one more class that's going to be soon knocked off your list of classes as you work towards your degree. So I'm looking forward to another great week of discussion. Well done, class. You've gotten most of the work done for the class. And I look forward to seeing you in the discussion groups. We'll see you there.